All right, so we will get started. Hello, everyone, and thank you for being here and listening to this presentation. Before we begin, I did want to mention Paige is going to put an evaluation link in the chat box. So if you could just take a couple minutes at some point today and fill that out, it'd be greatly appreciated. But yeah, so let's get into it. My name is Lauren Gethin, and I will be presenting today on preterm infant nutrition, or preemie nutrition. So some of the background, preemies are classified as infants born at less than 37 weeks gestation, and they usually weigh less than 5 pounds, 5 ounces. So a couple things that can cause premature birth. One is being pregnant with more than one baby, so twins, triplets, or even more than that, bleeding or other problems with the uterus, stress, as well as infection in the uterus or other parts of the body. These are just some risk factors, but there are a lot of premature births that happen and we just don't know why. It's kind of a gray area, but these are just some risk factors that we can look out for beforehand. Then women at risk for premature delivery, so those that have had a previous preterm birth, they're more prone to have another one. Those that are younger than 16 or older than 35, if they are a smoker, also if they have some sort of chronic illness such as heart or kidney disease, also being African American, as well as illegal drug use. And again, these are just some risk factors that we can look out for, but there are a lot of women that do have premature delivery and we just don't know why, and they didn't fit in one of these categories or have one of those risk factors that could cause premature birth. But these, again, are just some things that we can look out for. Also, over 1 million children die each year from preterm birth-related complications. Overall, the mortality has decreased and improved, but there's still a rising need to develop newer strategies for lowering the potential complications of preterm birth and just creating more success for these preemies to grow and develop and live a long life. So I thought that was really interesting to see in my research. Also, the placental transfer of nutrients occurs in the 3rd trimester, and with these preemies, they can miss out on that. So they don't have those nutrient stores after they are born that kind of normal term infants would have. So that's an extra challenge on top of everything else that's occurring within their bodies when they're born prematurely. Some complications of prematurity, so body temperature maintenance can be an issue, breathing problems, so asthma, blood problems such as anemia, jaundice, or hypoglycemia, kidney problems, as well as digestive issues, so trouble feeding, poor digestion, as well as necrotizing enterocolitis. So a lot of my research will kind of touch on that. But necrotizing enterocolitis is basically when the wall of the intestine is invaded by bacteria and it can destroy the wall of the bowel. So there's infection and inflammation, and it can be really common among preemies and something that we really look out for and try to prevent as much as possible. And that'll come up with some of the different nutrition strategies that I found. They can also experience nervous system issues as well as infections. Some adverse developmental issues associated with preterm birth. There can be a significant decrease in brain volume, an increased risk of neurological disabilities, low insulin sensitivity and high blood pressure, significantly lower bone mineral density, which can set them up for osteoporosis or other things like that later in life, as well as intra-abdominal fat, and a higher risk of metabolic complications. So the most critical period of brain growth and development is in the 3rd trimester. So for these preemies, those developmental processes really now have to take place in the hospital in the NICU. So it's a really important time to make sure that they are getting the right care and the right nutrition. So my reasoning for looking deeper into this research is Zach and Carter. So these are my brothers. They are twins. So Zach is the picture on the top left and Carter is on the bottom. So Carter was born at 2 pounds 2 ounces, and he actually dropped to 1 pound 12 ounces while in the hospital. Zach was born at 1 pound 14 ounces and dropped to 1 pound 6 ounces, while they were in the hospital. So they were born at 25 weeks gestation, so 15 weeks early, and they were in the hospital for about 100 days. So they went through a really hard road during those 100 days. And then kind of to show how small they are, because you kind of can't get the whole picture when it's just a picture of them, but on the right is them both in one car seat. So it kind of shows they could both fit in one car seat. And my mom had to point out they did not take them home like that. But it just kind of shows how small they are. And my dad's wedding band could actually fit around their leg. So kind of gives you more of a visual of really how small and tiny they were. So jumping into the first article, this one was called Optimizing Nutrition in Preterm Low Birth Weight Infants. So the objective for this study was to provide recommendations for clinicians to optimize nutrition in preemies. So they really wanted to create practical recommendations for enteral nutrition supplementation. So it was basically a bunch of professionals coming together and making these recommendations from all of the research and studies that they found. So there were 166 preemies involved in the study, weighing less than 3.3 pounds. And some of their findings or recommendations was that enteral nutrition is safe for these preemies and is really preferred to parental nutrition. Enteral nutrition was also found to aid in the development of the gut and lower the risk of infections and sepsis in these preemies. Early, fast, or continuous enteral nutrition was found to have better outcomes compared to delaying feeding, to late, slow, or intermittent feeding. Also, rapid advancement of enteral nutrition was associated with significantly less time required to achieve full feeding, as well as regain birth weight, a shorter hospital stay, comparable feed tolerance, and there was no increase in the risk of necrotizing enterocolitis. It was also recommended that expressed breast milk is the first choice for feeding these preemies. For enteral nutrition options, you could have expressed breast milk, fortified breast milk, formula, and then you can also use donor pasteurized human milk, which was found to be the second best choice. With these moms, sometimes they just can't produce enough milk, or any at all, even with term infants, sometimes that can be an issue, but especially with preemies. So having the donor human milk is also a great option. So in the study, preemies who were fed fortified breast milk had better growth than only human milk. So this is kind of the first time I'll kind of touch on this throughout all the rest of the articles as well, but we always hear breast milk is best, which it is, but in a fortified state for preemies, because preemies just have much higher nutrient needs and more complicated nutritional needs that just regular breast milk just isn't enough to meet their needs at this stage. So they do need that fortified aspect to it. But breast milk was found to have better feed tolerance for preemies, lower the risk of necrotizing enterocolitis, sepsis, reduce the length of hospital stay. It does play a protective role in preventing retinopathy of prematurity, as well as lower the risk of hypertension, atherosclerosis, as well as significantly increase whole body bone area and bone mineral content. It can improve neurological development later in life, as well as improving mental and psychomotor development and behavioral scores. So there's a lot of benefits of breast milk. Also, it was found that higher protein and energy intake during the first week after birth in these preemies was associated with higher mental development scores and lower risks of stunted growth at 18 months after birth. Higher protein is also associated with faster head growth and improved cognitive outcomes. So really showing that protein and a higher protein content really helps the growth and development of these preemies and is really, really important. So the protein recommendation that they found was 3.4 to 4 grams per kilogram per day, and that is dependent on birth weight and the desired growth. Also, human milk fortifier should be used only when the infant reaches a feed of 100 milliliters per kilogram per day. And it didn't say exactly why, but I would assume it has something to do with making sure that they're tolerating feeding and things like that before introducing the fortifier. Also, calories are usually met with that human milk fortifier, as well as protein and fat recommendations, which is really important to know that nothing else needs to be added because that fortifier with the breast milk will be just fine to meet the infant's needs. So some of the EL study findings, the table is the recommended enteral nutrition intake for preemies, which is really nice. It kind of talks about the amount of fluid that they would need, energy, as well as macronutrients, the range, as well as touching on some of the micronutrients that are going to be really important for these preemies' growth and development. No blinding was used in this study. It was also suggested monitoring for 2 years was highly recommended, and it would even be more beneficial to follow preemies through adolescence to really see the growth and development that occurs or doesn't occur depending on their feeding, using fortifier, not using fortifier, just using plain breast milk and things like that, because then we can see that growth and development for a longer period of time and see what really occurs. Also, this funding was done by Nestle Nutrition Institute in South Asia. So kind of an overall summary, it would have been nice to kind of look deeper into the actual research and studies that they based their recommendations on. They touched on some of it, but it really was more of a consensus summary of a bunch of different studies that the professionals put together. So it was kind of nice because they just gave you the recommendations, but hearing more about how they got those recommendations in the studies that they did would have been beneficial. Also, breast milk is best, but in a fortified state. I'll kind of say that a lot throughout the presentation, but because of the unique nutritional needs of these preemies, it really needs to be fortified to meet their full needs and help them grow and develop. Also, the earlier the enteral feeding starts, the better the outcomes. So enteral nutrition in this article was found to not increase the risk of necrotizing enterocolitis, and it actually helps develop the preemie's gut and reduces the risk of infection. So that was really, really important as well. So the second article was called Formula versus Donor Breast Milk for Feeding Preterm or Low Birth Weight Infants. So the objective of this study was to determine the effect of feeding with formula compared with donor breast milk on the growth and development of preterm or low birth weight infants. So there were 2 formulas that were used within the study. There was the standard term formula. So this is for term infants based on composition of mature breast milk. So it's anywhere between 67 to 70 calories per 100 mils. And then they used nutrient-enriched preterm formula, which provides nutrients to match intrauterine growth rates. So higher calories, so around 88 calories per 100 mils. So the nutrient-enriched preterm formula is made to try and mimic the growth that would happen if the baby weren't born yet, which is really, really important because of their unique and higher nutritional needs. So what they found in this study, the beneficial effect of donor breast milk occurred when it was taken as a supplement rather than a sole diet. However, the results, as mentioned, should be interpreted with caution. There were differences in the analysis of weight gain, linear growth, and head growth that can limit the validity of the effect that the study really had. Also, this review was taken from high-income countries. So in lower middle-income countries, the anti-infective properties of breast milk may really outweigh the lower rate of short-term growth. So in India, it was found that preemies have less common serious infections when they were fed breast milk rather than formula, which is really interesting and I never thought of because, you know, in some third world, low income countries, the possible infections and illnesses that those preemies can be subjected to, the mom may think that because breast milk has those high anti-infective properties, that may be more advantageous to them than their preemies' overall growth, which I found really interesting. So it could be different depending on, I guess, where the preemies are born and where they live, which I thought was really, really interesting. Some of the EL study findings. So in general, the feeds were allocated for several weeks or until the infant reached a certain weight, which was greater than 4.4 pounds. The study was done in Europe and North America, and there were 11 studies that fulfilled the criteria that they were looking at. So throughout all of the studies, 1,809 preemies were involved. All of the participants were clinically stable at gestational age of less than 32 weeks or less than 1,800 grams, which is about 4 pounds. Infants who had gastrointestinal or neurological problems were excluded from the studies, so it didn't skew any of the results. So 4 studies compared standard term formula versus donor breast milk, and 7 trials compared nutrient-enriched preterm formula versus donor breast milk. But the trials did vary according to the type of breast milk that they used, so being fortified versus not fortified, which is super, super important and a big limitation to actually taking the recommendations from the study, because it kind of touches on it, but if the breast milk was fortified, I believe that their recommendation and their results would have shown that the fortified breast milk is better for growth and development, as well as being anti-infective for these preemies, rather than formula. So that's a huge limitation of the study. So kind of summarizing the whole study, preemies' nutrient needs, again, are so high that non-fortified breast milk, it was found just to not be good enough. It can be used as a supplement, but as a full and sole diet, it just wasn't meeting the preemies' needs. So in this study, growth was significantly better with preterm formula. However, the risk of necrotizing enterocolitis was nearly doubled, which really just shows the anti-infective properties that breast milk has. So in this study, it kind of went against the other study in that it's saying formula was better, but again, some of the studies didn't have fortified breast milk and some did. So that limits kind of the recommendations that the study gave us. Also, there is limited research on formula versus nutrient-fortified human milk. So comparing the preterm formula versus nutrient-fortified human milk would have been a better comparison, because those are the 2 options that we would really be looking at for preemies. So having some more studies on that would be really, really beneficial to find more recommendations. So then the third article was a lot different than the other 2 articles. So this one was called Increased Human Milk Exposure in the NICU Through the Development of a Premature Infant Nutrition and Lactation Team. So some of the background for this study, preemies deal with a ton of challenges, but they deal with the challenge of keeping up with the intrauterine growth rates, as well as dealing with the metabolic demands of their acute illness. So they have a lot that they're fighting against when they're born. Also, breast milk has been shown to be protective against necrotizing enterocolitis, sepsis, and improved neurological outcomes. However, less than 50% of preemies actually will go home on breast milk, and even fewer are completely breastfed. So it really shows a gap in the ability of the mother to successfully produce enough milk for the preemie. So kind of like I said, with women who give birth to term infants, it can be an issue. They may not produce enough milk or any at all, but with women who give birth to preemies, it can be even more difficult just because it's an unusual circumstance. And with the stress and everything going along with it, it might just might just not happen. So that's where donor milk can really, really come in helpful. Also, not having a multidisciplinary team produced suboptimal improvement for these preemies. So the objective of the study was to demonstrate that a collaborative nutrition team can really improve human milk intake in the NICU and overall help these preemies succeed and grow and develop better over the years. So what they did, they started this team in 2007. So they produced a team with a dietitian, nurses, nurse practitioners, pediatricians, neonatologists, nurse educators, as well as occupational therapists. They took benchmark measures of human milk intake of very low birth weight infants before and after the formation of this team. So in 2006, they took a bunch of different measures, and then in 2007, they took the same, as well as 2008 after the formation of the team. And along with just creating this team, they also included an educational program for nurses and physicians, updated feeding protocols, additional lactation support, improved milk handling, as well as research study implementation. So they created a lot of resources along with the team in general. So these are some of the results. So infants born after implementation of the team had better outcomes. They regained birth weight 2 days earlier. They received more milk feeding at the time of discharge. The average human milk intake increased at the time of discharge, and rates of necrotizing enterocolitis decreased. So in 2006, before the team was started, it was 7.5%. And then in 2007, after the team was started, it was 5.3. And then in 2008, it was 1%. So a huge jump and a huge decrease just shows a lot of the benefits of this team starting. So this table shows a lot of the different factors that they looked at. So SPIN is just the name of their team that they created. I'm not sure what it stands for, but it's just pre-team starting and then after the team started. So looking at the gestational age, the length of stay went down significantly. Percent human milk intake at discharge increased to 86%. The percent of full human milk intake at discharge increased to 67%, which is really big. So overall, these preemies were taking in more breast milk and they were tolerating it better. And they got to full feeds earlier after this team was started. So this is one of the resources that they created. So this is a fortification table, and it kind of it's just a resource for these clinicians to use based on how many mils the infant is taking in, how much fortifier to put in it, and things like that, just to give them a resource when helping out these moms and their preemies. And then this is another one. So this is a feeding guideline resource, and it kind of goes through what day the preemie is on of feeding, and then kind of the rate and weight and just how they should be progressing. So all of these resources really help these clinicians provide the best care that they could. So some of the EAL study findings, SPIN, again, just the name of the interdisciplinary team. So before the team was started, there were 37 preemies that were measured. After the team was started, there were 71 preemies measured. The study was done in San Diego, California, and very low birth weight infants were used in the study. So to classify an infant as very low birth weight, they would have to weigh less than 1,500 grams or 3 pounds, 4 ounces. And if you kind of think back to what my brothers weighed, they weighed between 1 and 2 pounds and kind of dropped, but I can't remember what extremely low birth weight the classification is, but they would be closer to that side. So kind of just gives you a visual. And then baseline demographics were the same for all of these groups, including gestational age, birth weight, as well as hospital stay. However, gestational age was not mentioned. So kind of an overall summary of this article. I think the main part that I got out of it was that interdisciplinary work is so important, and not just in this population, but everywhere in healthcare. I think I've also seen that throughout this whole year of rotations, that when a bunch of different disciplines just work together, the success of the patient is so much greater, and it really just benefits the patient even more. But especially in these preemies, it helped their growth, their development, their feed tolerance, everything like that, as well as decreased rate of infections and things like that, because they were taking in more breast milk with those anti-infective properties. So creating all of this team with a bunch of different disciplines was so helpful for the mom and for the infant. Breastfeeding has been shown to have such significant positive health outcomes for preemies. It really is amazing, everything that it can help preemies with growth and development wise. So that was a huge aspect of this whole study, to try and increase breastfeeding and the rate of breastfeeding. So it was really shown to increase their health outcomes. However, a deeper understanding of the specific interventions would have been helpful. They talked a little bit about it, but going just deeper into what they actually did and their methods would have been nice to see. So kind of coming full circle, Zach and Carter, so they actually just turned 26 last week. So my dad is on the way far left, and then the two guys next to him are my brothers. They are twins, they look nothing alike, but they did just turn 26. They are healthy and strong. I guess kind of touching on complications, if you will. Carter does have asthma. That's really his only complication that he acquired from being a preemie. Zach, which is the redhead, he does have mild cerebral palsy, which can be a complication of preterm birth, but it is very mild. So those are kind of their outcomes, but overall they are healthy and strong 26 years later, and my whole family does call them miracle babies. I guess if you think about it, 26 years ago, being born at 25 weeks gestation, it's kind of crazy that they're here because of how far technology and our understanding of preemies and their nutritional needs has changed. So it is really cool to see a good outcome, and hopefully there are a bunch of outcomes like this in the future. And then citations, and then if anyone has any questions. Thank you for listening, everyone.
Great presentation, Lauren. I'm going to post the evaluation link one more time in the chat. If anyone has any questions for Lauren, you can either raise your hand and she'll call on you, or you can just type it in the chat. And then I also want to mention that our next presentations will start at 11, and you can either listen to Josie's presentation on micronutrients in pregnancy or Julie's presentation on intuitive eating and the effects on eating behaviors.